Fawzi, the time is yours. You may present your article.
Okay, let me share my presentation first.
Bapak Fawzi coming from University Utara Malaysia ya Pak ya?
Yes, true. Yes.
Okay.
All right, now can everyone see the PowerPoint?
Yes, Bapak. Okay.
Okay, let me make it a full screen. All right, is it okay?
Yeah, okay, Bapak.
All right, I will start. All right, good afternoon, everyone. Firstly, I would like to say thank you very much for having me in this valuable event of the 4th International Seminar on Tourism 2020. And also thanks a lot for the event organizer. Really appreciate for your the opportunity given to me. And without further ado, let me proceed towards my presentation entitled Impacts of COVID-19 on National Security in Indonesia and the Alternative of Solution of National Policy Solutions. So actually the study is done with my two colleagues, which are Mr. Andika and also Mr. Agung. Okay, first the issue of coronavirus has infected millions of people around the world of around 185 countries, and the spread has significantly left the worldwide business to counting the huge cost. This pandemic also hits the stock markets of global shares of Nikkei, Dow Jones Industrial Average, and the Financial Times Stock Exchange to receive a great fall since the beginning of the outbreak on December 31st, 2019. As we know, recently it has reached more than around 40 million of confirmed cases worldwide, along with around 31.6 million people who have recovered and 1.2 million of the death case. Then Indonesia is chosen in this study due to the recognition as one of the most vulnerable countries in terms of the rapid and fatal spread of the pandemic. And academically, this study is expected to give contribution in knowledge expansion on different issues affecting potential aspects on national security in Indonesia related to COVID-19 outbreak. And practically, it is directed to Indonesian government and related parties for the applicable alternative of solutions to potentially cope with the outbreak. And then, okay, based on this figure 1.1, it is when the study was conducted, we can see that as on Saturday, June 27, 2020, Indonesia reported an additional around 1,385 cases, bringing to the total exactly towards 52,412 cases since the virus spread starting on March 2nd, 2020. Means that within around 3 months from March 2020, there was already more than 50,000 cases happen in Indonesia. And then if we take a look at the current situation, as on October 25th, 2020, it has been more than 400,000 cases in Indonesia. Also, it is for sure a significant increase from the last time the study was conducted in June 2020. Okay, next, these are the research framework and methodology from the COVID-19 pandemic itself towards our national security in Indonesia that consists of law enforcement, health security, economic security, social security, food security, and finally the issue of supply chain management. Then the data in this research is the secondary data in the form of global and national information related to the current coronavirus issue to national security, especially in Indonesia. And then based on its characteristic, the data being used is the quantitative data, and the source of data is taken from the websites and online articles, which are potentially focusing on coronavirus, including the influences and challenges. Also, the technique used in the data collection is the documents and records by looking and analyzing the information available and provided in the related websites and online articles. The research analysis technique chosen in the study is the descriptive analysis. Okay, next, here comes the findings. Firstly, based on the law enforcement, there's an existence of the new government regulation number 21 of 2020 concerning the large-scale social restriction, and also the civil emergency policy regulated in law number 23 of 1959. Also, this result in line with the research result done by Farah Laxmi and Sweta 2019, and also Lin and Friend 2020, related to the social distancing and regions lockdown. Also, from the health security, there's existence of massive health quarantine activity based on the current COVID-19 in Indonesia, also including with the confirmed case, recovered case, and death case. And also this research result in line with Kandel and Friend 2020 and Park and Friend 2020 related with the health security issue against any tour and travel activities, including the social distancing in the country's region. This is when the last time the study was conducted on June 27, and we can see actually this is what will make the public emergency happen, because within 3 months from starting March 2nd, there's already more than 50,000 cases in Indonesia, and I believe currently nowadays it's already more than 400 cases in Indonesia, with around 14,000 of these cases happening. And also based on the economic security, this is also based on the GDP growth and the foreign exchange rate, which forecasted for the GDP growth already downgraded for this year from around 5% towards 2.5% for 2020, and also the high fluctuation of exchange rate for rupiah against US dollar. And also these results support by the Mamun and Ufa 2020, and also Nicholas and Friend 2020, relating to the issue and the influence of decrease of countries' GDP, and also increase of countries' unemployment, as well as the issue of countries' exchange rate in the research. Also next, based on the social security, that I think we all have known that there's an existence of social distancing and the lockdown protocol, including the work from home activities. And this result also in line with Yesley and Khan 2020, and also Martinez and Friend 2020, relating to the implementation of social distancing and self-quarantine within the country's region. This is the look for the GDP forecasting for this year of Indonesia. Already downgraded towards 2.5% based on Jan 2020 and GIL 2020. And also based on the exchange rate issue, we can see that around March and April, our rupiah dropped towards around $60,000 rupiah per US dollar. But this already better performance during May and June, I think perhaps due to all the policies and any repressive actions done by our government during the time. And also next, based on the food security, based on our research, there's no evidence that the corona transmission can be through the packaged food. And also this result also in line with the Kapelian Sini 2020, and also Handu and Friend 2020, where they stated that actually they confirmed that the virus significantly only spreads and infects through the body contact, coughing or sneezing. And also eventually from the supply chain management and industrial production issue, actually this is a disruption for this COVID-19 outbreak, where there's lots of issues on material supply, scarcity and material stock, and overstock due to weak demand, especially regarding the export-import activity. And also this is actually based very fundamentally due to that our country is very dependent on raw materials from China. And also this results in line with the Sokrani and Friend and Gavindam and Friend 2020, relating to the issue of export-import activities that has become a disturbance to the country's supply chain management. And for the last section, for the policy recommendation, here we have three aspects, which are case identification, decrease of the death case, and the termination of transmission chain of the COVID outbreak. For the case identification, for sure, to identify the case size and location done by the RPD or PCR tests. And then it's recommended that the government to improve the test facility in the early stage so we can cope with this spread of COVID-19. And for the decrease of death case, actually it's due to lack of facility that I have mentioned before, including the hospital service. And also, it's recommended to increase the personal protective equipment, PPE, medications, symptoms, and other any potential actions that can reduce the risk to the spread of COVID-19. And finally, the termination of transmission chain is actually a responsibility for all the parties, done by both the government and the community. And also, this is including with potential community contributions for conducting proper self-quarantine or even the regional quarantine. And additionally, we propose to the local governments in every region in Indonesia, which firstly, it's related with the policies oriented towards the strict community mobilization, and then secondly, to improve the coordination and information update to the needs for the personal protection for the citizen in every region, and also third, strengthen the readiness of the health facility in the regional hospitals by increasing the capacity of community health center, prevention, detection, handling, and monitoring for the case of the COVID-19 currently. And next, also is important and necessary for having active involvement from the community. By, for example, it can be potential to conduct the COVID-19 alert village in the village, and eventually for effective collaboration and cooperation for every parties in every sectors and philanthropics, universities, and other non-governmental organizations in order to support and help coping with the spread of COVID-19 currently in Indonesia. Okay, that's it. I think all for our presentation. Thank you very much for your attention and have a good day.
Okay, thank you, Mr. Fawzi. It is, yeah, because the policy and the action. I will proceed this presentations, and the answers and the questions will be held on the chat room. Is it okay for you,
Okay.
Mr. Fawzi?
Yeah, it's fine.
Okay.
Okay, thank you very much.
Okay, yeah. Thank you. Thank you for your time. It is very interesting because very, very detailed in what all the Indonesian government do to overcome the COVID situations.
Okay.
Thank you. The next presentations will be held